Welcome to Metro Medical Group presents Sadaaqa. Now, Sadaaqa, as you know, friends, explores, celebrates, documents the very, very old relationship between India and Kuwait. And we have done it by highlighting various examples of Indian entrepreneurship in Kuwait. We have also spoken to lots of Kuwaitis who have close connections with India. Now, our sponsor today, which is Metro, the founder of Metro, is a sterling example of Indian entrepreneurship here in Kuwait. Now, I had heard of Metro 10 years back, but I did not, frankly speaking, I did not use their services until COVID. And I want to emphasize this here, that Metro Medical Group was one of the first line of defense for many people who are seeking affordable health care in Kuwait during COVID. Now, my husband had COVID and he was not in a good shape, and he was later shifted to the containment center, but before that he received very, very good treatment at Metro Salmiya. And so the emphasis here on Metro is on affordable private health care. Now, we all know how expensive healthcare is in Kuwait. Metro Medical Group provides highly qualified professionals with quality and affordable healthcare in Kuwait to thousands and thousands of people. Today, Sadaaqa is proud to present the founder, the man who had the vision and courage to establish a chain of clinics and pharmacies all over the country, serving people of different nationalities and serving people of different economic abilities. I mean, people rich, poor, middle class, they all come here to Metro. Now, Mr. Musthafa Hamza is the group chairman and CEO of Metro Medical Group Kuwait, one of Kuwait's leading entrepreneur. He's a philanthropist, and I think philanthropy and charity lies at the root of all that he has achieved and all that he has done so far. Now, the man who is loved by his staff as a humble, down-to-earth person is also, as I said, known for his deep commitment to community welfare. And we are looking so very much forward to knowing more about his story. And I'd like to take this opportunity to thank the sponsors who have been a part of Metro Medical Group presents Sadaaqa. Like we have Mugal Mahal, the chain of Indian restaurants, AlMullah Exchange Group that has been serving expatriates and Kuwaitis alike for so many years in different parts of Kuwait, and Al Group, one of the largest chain of automobile services here in Kuwait. All sterling examples. Mugal Mahal and Al are examples of Indian business skills here in Kuwait, and AlMullah Exchange is managed by hundreds and hundreds of Indians. So it's basically a celebration of all that is Indian here in Kuwait. Welcome to Metro Medical Group presents Sadaaqa, and we are so honored to have with us Mr. Musthafa Hamza. You are such a great example of Indian entrepreneurship in Kuwait. I am so honored to have you on the show. Thank you very much for being here with us. I know how busy you are, how difficult it has been for us to pin him down. One just cannot imagine. But I am so glad that it has finally happened.
Thank you.
So I want to ask you, Mr. Hamza, tell us briefly about your growing up years in India. I remember you were telling me off the record, when we were not recording, that you came from a very poor background, very humble beginnings. How do you recall those years?
When I came to Gulf, the year of, I think, 1983.
Okay, 83
1983,
is a long time.
this is 40 years now, more than 40 years
so
now.
This was before the invasion.
Yeah, yes. That time my age was really 15.
But before that, I asked you about your childhood.
Yeah.
How was it in Kerala? You grew up in Kerala?
Yeah, of course. Actually, this is my family background is, we are very poor family. And at same time, the well-known family, like Underegathu family, it means wherever you go in Kannur,
they will know you.
Nearby yeah, they will take you to my house. So, but financially,
Yeah.
we are very poor.
It happens, yes.
It was, and that time is very, we are a lot of things to be faced.
Okay. And then at the
And
age of
my
15,
father,
sorry, I
yeah,
shouldn't have interrupted you.
yeah,
You're talking about your
yeah,
father, yes.
yeah. My father is like we say, Maulana, Mullah.
Okay.
Is a very gentle person. Actually, he's teaching some other place to Islamic studies and this. And they are always saying, see, my teaching place, this is you are not poor, you are a rich people than that poor. It means like there that area, 100% poor people was there. So little bit getting the salary or something, that
Yeah,
place,
that
this
makes you rich.
money they are my father spending to same place.
My God.
And so we are very 100% our poor, it means 100%.
Yeah, yeah.
So I'm in my total five brothers and sisters, 3 brothers and 2 sisters. I'm an elder one.
You're the
So
oldest.
yeah, so responsibility, everything on my head. So when I was in 15 years, before that, the study time, I was working like in a hotel, and then
Supporting your.
yeah, supporting to here and there to support my mother and my brothers and sisters.
I see.
When I was in 15, so my cousin brother given visa to Dubai 1983. That time the rules of India, I think 16 or 18 to minimum.
I see.
So,
And you were 15.
yeah, this is 50. That time, I don't know if this is can or not. There is some pushing, and if less age, we can make a pushing. That time, my passport was also is 2 year. My grandfather make an
That used to happen in those
yes,
days,
yeah,
right?
that,
You
yeah,
used
that,
to,
yeah,
yes.
yeah.
It used to
And
happen.
so 15 years, it means that the according the passport age, this is cross the age 17.
Yeah, yeah, yeah.
But that
Actual age.
immigration people is not believing
Because
this
you
is
look so
18.
young.
Yeah. So that time I know I given an 50 rupees Mumbai airport to push to
We don't want to talk about that, right?
yeah, yeah. But this is whatever you can
Yeah, 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 yeah.
off record or on record, whatever you can. And
No, but that's
this is
how
the
it used to be
yeah.
in those
And
days.
that time they ask, they promise, and we are finalized 50 rupees. Finally, we don't have final rupees, 45 rupees.
Yeah.
That person kindly said, go ahead, no problem.
Okay, okay.
45. So when I reach in Dubai, you know, my age is 15 because nobody is an education level and the age level, I am not fit for anything.
Okay.
So I know this is, I have to start some work.
Okay.
So I started and work like really this is I am not ashamed to say that I am not shy of for that. This is my real life. I started in Dubai Gold Souk car wash,
A
car
car wash.
washing.
Mr.
Car
Musthafa,
wash is
I just want
means
to say here, you should never say that, you know, you are a model of inspiration to people for your rise, you know, for the way you have worked hard, not just for yourself, but for the community.
yes, yes.
There
This
can
is
be, it is, I feel, such an inspiration that a person who worked in the gold souk doing car wash at the age of 15 is now has co-founded a chain of health clinics and health centers, you know, which provides the best health care in the country and which is catering to thousands of people daily. I think it's a great example. It's a great story.
See, no, see, I am the 1983. There
Yeah.
is no any automatic car washing system in
All manual.
UAE. All manual. 5 o'clock after my morning prayer, I just start a single basket water and towel, single one. Before 8 a.m., I have lot of money already. I cover it in between in these
You work so
2-3
much.
hours.
Okay.
So, man, 100. Vaji Bhai.
Why do you say that?
Because he's given me everything. Once
Okay.
when I started his car cleaning, like within a month, he asked me, after this your car washing, what is your work? I said, I am
Okay.
going to, this is, my room is very near and sleeping. Said, see, I will teach you goldsmiths, gold work. And
Okay.
gold work, I know, and this is my blood and
Okay.
work. I know a little bit from my, actually, he started to see. He said, "Please come to my to my factory," and he was not a very rich person.
Yeah.
He said, and he started my career really in a goldsmith, as a goldsmith, and me and Vajubhai is same like a partner. He is and his son Jagubai, Chitubai, and Vipulbai and Meenaben.
Okay.
When he start, when actually this is the four and this all and boys and girls, Meena Ben is girl and
Yeah,
other
yeah. The brothers and
three boys.
sister.
But he's always looking at me. You are same my son.
So he treated you as
He,
family.
and not only family,
Yeah.
and really, this is not. I maybe I cannot continue if I am talking and more about my Vajubai. He's same like my dad,
I understand.
and he teach me. I am a Muslim. He is an Hindus. He actually he was teaching me to how to pray, how to Islamic study, how to Islamic
Really?
class. He is joined me to Islamic class to study, and I was staying with his home.
Acha. Okay.
And Babi and is given me everything same like own son and daughter.
I see. So your story is also your beginning
And within
story?
after 6 months, me and Vajubai started same like a partnership business in gold.
Okay. So you started your business with him. And that will be when?
This is 1983, 1984.
84.
90, this was 84, and
You were
the
16.
yeah that time 16, and when after 16 I got in the UAE driving license. So I asked Vajubai, you want to sell your Cressida car? See, that car I was washing. eh? So now, after 1.5 year, I am negotiating to how much
To
you are,
buy
and
that.
if you want to. Actually, he was planning to buy some new car.
Okay.
So, what is you are planning to? He said, if you need, I will give you free. I said, no, no, you are given lot of things, but this is take some. So I buy it this car on my name. This car was actually that car was giving food before. After that, after 1.5 year, that car my own.
Buy. So you bought a car
So
at
I
the age of
brought
16.
this 16 and a half.
Yeah, 16 and a half. Okay.
This is the
Yeah.
story of. Then we
Fascinating.
make a partnership business in gold. This is like within 3, 4, 5 years, I become the good
Well established.
well established, like and a good I think more than almost 8 kilo 10 kilo gold in on my name.
I see.
It means this Vajubai is given.
I see. Okay.
Vajubai is like this is the person is I'll never ever
Okay. Are you
seen.
still in touch with them?
Before, yeah, no, before, actually he's now passed away.
Okay.
And before, actually I think 6 months back, before
Okay.
Diwali, they call all and Jagubai, Jitubai and Vipulbai and Meenabai and Rajubai, everybody is together. He said, see, now you are four.
Okay.
This is the chapati. If actually not in front of me, I was not there
Okay.
for this lunch. Still, I remember. He said, see, if you make this part, this only you have one chapati.
Divide
So
it.
if you are divide, how many piece you will divide? Leave me and your mother. Now we are four. How you divide?
Okay.
Some people say four.
Uh,
Some say Jagubai is and now is big, so no need to for him three.
okay.
So Meena Ben said, this chapati is make total 6
Okay.
for Jagubai, Vipulbai, Jitubai, Rajubai, Meena Ben, and Musabai. This is not Musthafa.
Musa Bhai.
Musabai. They are say this is Musabai. He said, okay, this is the right mark.
Oh, wonderful story.
So
Okay.
these people
I can imagine
is
the,
an,
the,
Gujarati and I know the Gujarati and how to talk. I
you know
know,
how to speak Gujarati. A
I know,
Malayali
and,
speaking in Gujarati, huh?
I know,
This can happen
I know.
only in India, I must say this. And what we heard just now was a wonderful example of Hindu-Muslim unity
Oh.
in a diverse country and secular country like India. I mean, these are the stories that Indian, our society thrives on. The people of our country, Christians, Hindus, Muslims, we all live side by side, and we are there for each other's support. And this is a shining example. This story that Musa Bhai just told us, it's a great story and a great example of this. So when did you come to Kuwait?
Actually, that time our centralized gold supplies from Dubai,
Okay.
from Sharjah. So that time like shuttle business to
Okay.
Qatar, to Kuwait,
So you're going all around.
Singapore and Mumbai, Doha. This is the shuttle business of we are sailing to gold all over Middle East. And before that, I have, because it is not to be complete if it is that not that story. See,
Okay.
you said some of South Indians and in our place, the Gujaratis means, oh, Gujarati is very bad people. Gujarati is like killing others, this
Business
and that.
oriented.
But I have been, I think, several times in Gujarat and in the Somnath Mandir temple. I was really, and I had food several times, and
Prasad.
Vajubai's house. This is for me, not for any separate room or separate hotel or separate. No, on home, on and the same like this is not only the Vajubai. I met many of Gujaratis really the language base, the the mingling and understanding each other. Really, it was my life experience. It was amazing, and this is the moment I have to give the big thanks to Gujaratis and people. They are not looking like this is Muslim and non-Muslim. Some of issues, some of incident maybe will happen.
Yeah.
That's this is not a completely
Yeah.
communal
Yeah.
and things I cannot. This is not
Yeah.
my level to speak
Yes.
because my own experience is the biggest teacher.
Absolutely, I agree with you.
So that is
Yeah.
yeah,
Experience is the biggest teacher. Now,
yeah.
if we can fast forward a little bit and come to Kuwait, when is it that you decided to shift to Kuwait?
This is 1999
Okay.
when I stopped my gold business. My father,
Okay.
actually before, as I said, he's a Maulana. So he don't like to, and the gold business, he's
Okay.
told me to discontinue. He's pressurized really and to forcefully to say, please don't continue this gold business.
Okay.
Uh, Maybe the gold business is some of I cannot by interview I cannot tell.
I understand. But for whatever reason, he asked you to
He asked,
stop the business.
he said to stop, so I stopped.
Okay, so your father asked you to stop the business and you stopped. Now, when I was first introduced to you, which was many years back in the Indian embassy, I was told that, that you were associated with the Malayalam media. Now, how did that happen? I mean, you were a businessman, you were into gold and then you went into other things. How did your interest in media come about? When did that happen?
Yeah, in my career, especially in Kuwait, 10 years I was working in a banking
Okay.
company. As a banking company, as you know, the weekly 2 days off
Yeah.
and 6 or 7 hours the duty. After that, completely my all and time I am spending with poor and needy people as a social worker.
Okay.
This is in my hand. I think more than 300 dead body I sent with my association like Kuwait Kerala Muslim Association,
Okay.
KKMA. I was there. I was with this association almost 20 years now.
I
I'm
see.
busy. That's why I'm not
Yeah.
an contribution or I'm not spending more time to in this association. But when I was there and with my colleagues, like maybe you heard that name, the Sagir Trikerpur,
Yeah.
who and died on the corona during the corona, is a well-known and well-known social worker. He's a well-known person, public person, and well-known figure. Like he's a really very kind person. He's asked to how to reach the poor people.
Okay.
So I was spending this
Free time.
free time to do for embassy work and you should know that this is more than 1 million. It means 1,063,000 Indians
Yeah.
in Kuwait.
Yeah.
This is almost half. 4.5 or 500,000 people are. This is 20 number domestic visa.
Domestic helpers.
So the domestic visa, this is like a domestic. They are supporting like house driver,
Yes.
housekeeping,
Yes.
and house boys. Like
Yeah.
different categories, people are here. So they are facing lot of problems. They have lot of issues, but this is nobody can't bring out in the authorities level because they are poor people. There is no they have a voice to say, but how to telecast, how to brought to
Yeah.
authority, they don't have
They
any.
don't know. They don't have the
They don't
know-how.
have any source of to. So my passion was there that time to I have to like franchise. I have taken the franchises Jeevan TV. So many of stories we made for poor and needy people how to living in Kuwait. What is the role of families?
I
Well,
see.
so it's a lot of they are suffering. They are facing lot of issues.
And you
So
focused on
yeah,
that.
I focused on
Okay.
that as a social worker. This is too social worker and also the media.
As a media
Yeah,
person.
media
So
persons.
media allowed you to bring together your need to communicate. I'm sure that was one also, one quality in you, that you were able to communicate with people, and also the fact that you could translate to bring the plight of the poor people and highlight it, bring it to, send the news to India, right? That this is
Yes.
what is happening here. So you mentioned banking, working for a banking institution. Then when was it that you started to envision starting a medical center? Was it connected with your social work role?
Yes, this is, see, when for me and for you, even any rich people, any of extraordinary people or poor people, needy people, to sick, it means the pain for all same, like
Yeah.
the maybe there is severe pain. It means for me less pain, and for you severe pain, not like this.
Yeah.
The pain, it means pain. The needy people, like, sorry, the domestic, as I said, 500,000 people especially in Indians in Kuwait, not only Indians, Sri Lanka,
Yeah.
Bangladesh,
Bangladeshis, yeah.
Pakistan, the different countries, poor people.
South Asians.
Yeah, they have really, actually 75% of people, they don't have any sickness or anything.
Yeah.
Any chronic situation is not there. But psychological, they are thinking, I am a sick, I am maybe I have to go to cardiology, have to go to, for my kidney function is going on. So if they are going to any medical center or hospital, at least 3 month salaries to minimum to spend there.
You're right.
So that time I was thinking, okay, of course, I have, and the money is there, not much more, like.
Yeah.
So I thought to help, how to help these people.
Okay.
So I joined a private medical center as a manager, as a country head. So this medical center not come as per my level of to help to ordinary people.
Okay. So
So
okay.
I same time I resigned, and in this center I started. This is a really very big challenge. I started my own medical center. This is the Farwania Metro Medical Group, Farwania. Actually, this was very big and very big challenge.
I'm sure.
Challenge, but I know, if I don't care to this challenge, I have to support this people. In Kuwait, the first medical center, they are, and like, if you are spending 1 KD, so you can get in this 1 KD any of specialist or GP consultation fees.
I think
only
this is
1 KD.
extraordinary. I've not seen this. Yani 1 KD private healthcare for just 1 dinar is.
Yeah. This is when we started 1 KD. Lot of medical centers and hospital, they came to me. Are you mad? What is happening? Why you are giving 1 KD? This is not government. I said, this see, this is, I have to do. This is my challenge. In this challenge, I will be, inshallah, I will be, and it will come with growth, inshallah, within 10 years. I said these people, within 10 years, all over the Kuwait, all over the area, I will make it the medical center to support to not only poor people, to all.
Everybody.
Now, that time only 2% was Arabic people. Now, 48% Arabic patients is coming to Metro. Daily 5,000 patients, more than 5,000 patients a daily, and more than hundreds of 123 doctors, and we have all specialty. We, Metro Medical Group, one of the largest, one of the highest, one of the branded, one of the best medical service in Kuwait. This is the Metro Medical Group. And we have all specialties like MRI, CT, and BMD, and operation, the international level of standard, the operation theatre, surgeon, cardiology, neurology, urology, Indian medicine,
everything.
everything. And if it is I'm coming to back to poor people. See, daily in this out of 5,000 people, 70 to 100 daily patients, nothing. They don't have a single dinar. They are coming to metro. I'm giving free of charge treatment.
Okay.
Because of this is not my support. This is 5,000 people's support I'm giving to
You're giving a certain,
80 or
you're able to give that.
89,000.
89,000?
89,000 patients we already given free of charge treatment. We
Okay.
have all civil IDs number and telephone number, everything by medical camp and the direct approach to metro. 89, more than 89. This 89,000, I think, 2 months back.
That was the statistic.
This is now
It has
to
increased.
change. Yeah.
You also mentioned a poor patient fund to
Yeah.
me. What was that? I mean, that was also new to Metro. I
Yeah, a poor patient fund, it means like, see, the receptionist, they don't know how to they know this is poor or rich.
think. Okay.
And publicly, as a social work, everyone know me. So wherever I'm going to as a guest, as a speaker, or I'm publicly I'm telling, see, if beside of you, in front of, back of you, anybody, if they don't have money to spend for treatment, special treatment, like in a severe treatment, to please give by your reference to and send to metro. We will give the free of charge treatment.
I see.
This is the patient. That's why we make a poor patient fund. Poor patient fund. Our doctors, our staff, our management, and my partners. Those all are contributing this amount for poor patient fund.
I see.
Last 2 months back, one lady came as a patient. So that lady asked to receptionist, why you are taking me money, and beside of me that one patient was there, you are not right of, no need to pay. Why? What is the method of this?
Okay.
How? Says this is poor patient. How you know she's a poor patient? How you know I am a rich? So in between our manager explained everything to this patient, and directly that lady came to my office and she asked me all details.
Okay.
So this is as an interview. I cannot give you the more details, like because of we don't have time. So I very briefly I explained to this lady. So immediately on the spot, this lady and a 500 dinar given to me and said, please don't mention my name anywhere except Allah, God.
Okay.
So whenever you are giving dua, please include me.
Okay.
And why I am taking this chance to again, 2 weeks back that lady came to this is actually I was busy. I was out of Kuwait. So that lady came to Mr. Faisal, my manager. He said, where is Mr. Hamza? I have to give some contribute to poor patient fund. So Hamza is not here. No. So no problem. So immediately she given again one more 1,500 dinar.
Can you imagine? That's
see,
a huge amount.
See, so
charity grows.
So
right?
yeah. So domestic visa people and some of people are coming maybe 5 kd, 10 kd in pocket, and the treatment is more than 50 kd, 60 kd. Some time is some procedures, some lab investigation, some X-ray or MRI. They don't have 5 to 10 kd. They have only this much money.
I know.
So we are giving free of charge. Rest of money we are giving, and they don't have money to go by taxi
Even
to home.
That.
So we are paying,
you're paying for their...
I have hundreds of experience that, but I am very happy. Me and my partners and even my doctors and entire our staff, they are happy. They are humanitarian based and a service. We are providing humanitarian based.
Extraordinary, absolutely.
Yeah.
Now, I want to ask you a few more questions, but before that, we have a section which is being introduced from this episode. It's called Know Your Metro. So we have to take a break for that. Know Your Metro. In the Know Your Metro section, we will introduce you to Metro, its doctors and facilities in different parts of Kuwait. Now, Metro Clinic started in 2015 as a medical care facility in Farwania. A year later, in 2016, the new Metro Medical Care in Salmiya opened. Two super Metro specialized medical centers opened in Salmiya and Fahil in the following years. Last year, Metro opened a clinic in Khaitan, and a few weeks back, they opened a huge facility in Jilib al-Shuwaik. Now, as of now, the group has 6 clinics and 7 pharmacies. Metro is known for its hand-picked doctors and medical and paramedical staff. They provide affordable and best available healthcare services in Kuwait. They also have daycare surgery at their Super Metro Specialized Medical Center in Salmiya. They also provide MRI, CT and DEXA scan in the different branches. As of now, Metro has 123 doctors, 100 plus doctors, 600 plus employees, and they treat about 5,000 patients a month. And this is very soon going to increase to 6,000 patients. So there's a lot going on in Metro. Welcome back. After that break, we are speaking to Mr. Musthafa Hamza of Metro Medical Group, and we are here in Metro Medical Group presents Sadaaqa. But before we go any further, we need to mention another sponsor who has been a part of Sadaaqa's journey from the very beginning, and that is AlMullah Exchange. And AlMullah Exchange, Mr. Musthafa, I think that you know them very well. You have personal connections with them, if I'm not mistaken.
Yeah.
Yes.
Yeah.
So,
After break, in between us, one box came in between us. The AlMullah, this is really the wonderful experience story in between me and not Metro, me and AlMullah.
you and AlMullah.
Dabar sir is chief manager, and now the Koshi sir is there. And before that, the John sir. John sir is my best friend. Actually, when he joined 2006, I think maybe maybe it is 2006 or something. That time the AlMullah was only 5 to 10 branches. Now the cross 100, it means like more than 115 or maybe I don't know the exact the count, more than 115 branches. As a best friend, I supported a lot of things to Mr. John. And John is very kind person, and he supported as our association when we worked before.
Okay.
KKMA.
That's
that time, not only KKMA, many of my, where I work as a social and a working time, they supported a sponsor, as a for needy people to, they are not taking sometimes is service money, like if some people are sending 1,000 rupees or 1,000 rupees they are sending, but the service charge is same. 10% is 1 KD, 270 rupees.
That's right.
So if I call to John, please and leave it this 1 KD, they will not take the. So after that, our connection is very big connection. I think he's conducted 120, more than 115 or 120 public programs.
Absolutely, under the directorship
different,
of Mr. Dawar.
This is Philippine program, Indians programs, and film star programs. I think lot of, and I given a support like government interior department, like home department. You know the without permission nobody can't do any kind of programs, and especially film program, artist program.
Facilitated that.
I facilitated and to more than 95. Actually, I am spending, and this is not easy to get the permission. In my business time also, I was spending for AlMullah to get this. I think More than 95. Exact count.
So you are an old friend of AlMullah Exchange. So it makes it even more sense to give you this very, very special gift, which AlMullah has given to give out to our guest on the show. And we are very grateful to AlMullah as well, because without corporate partnership, a program like this, which which involves 6 or 7 people, where we are trying to bring human stories in front of people, it is not possible. So thank you, AlMullah, thank you, Metro, and we are going to thank Mugal Mahal as well, our other partners. So thank you, Mr. Musthafa. This is on behalf of AlMullah.
This is I am giving back to John sir. This is my dedication to John sir and John sir and Davar sir. Thanks a lot.
Yes, and I shall send this episode to John. So that he can watch it.
He's in Canada.
He's in Canada. I'm aware of that. So I'm sure he will be very happy to hear from you.
Of course.
Yes. So that was AlMullah, and I want to go back to talking about Metro, Mr. Hamza. We have seen a meteoric rise in Metro Clinic. You have grown from one clinic to so many clinics and pharmacy serving many people. What do you think has helped in this meteoric rise? Of course, the fact that you are affordable, that is one reason. But I'm sure that there are many other reasons also, because of which Metro has been able to, make a niche, make a strong grip in the market here in Kuwait.
See, first of all, if any patients coming to Metro, the all facilities there, and with the experienced doctors there, our can talk to own language. And some of hospital and medical centers, they are the consultation charge, example, maybe 10 times of Metro.
Okay.
They are seeing like 5 to 10 patients, 5 to 10 patients in the 8 hours duty timing. At same time, I instructed to my doctors, please, in this instead of 5 to 10 patients, to make 50 to 100.
Okay.
And the level of see, if there is some hospital charging example is 40 kd, you charge only 4 kd.
Yeah. Okay. Makes sense.
So our profit, we can collect it from
the number.
Bulk
numbers. I understand. Yes.
So this is the business.
And you also have doctors of many different specializations, right?
Yeah.
I mean, orthopedists.
We have orthopedic, gynecology, pediatric, ophthalmologist, and gynecology, urology, neurology, cardiology, endocrinology, GPs, and dermatology, cosmetology.
Everything.
Everything we have. And this is the business scenario is like if we are going to make the benefit from a single person better and make benefits, the benefit of same make from many people. So we can contribute to others. We can make more center, and inshallah we are thinking to in this 2024. Now we have 6 medical centers and 7 pharmacies. In this year, 3 more branches coming in Kuwait and 2 branches in UAE.
So you're expanding.
Abu Dhabi and Sharjah.
So it will become
this
international.
Is within 2 months it will be open it in UAE.
Abu Dhabi and Sharjah.
2025 or 26 beginning, multi-speciality hospital in Kuwait. We are planning to multi-speciality hospital.
That's wonderful. See, I mean, this is, now as an Indian, I'm going to ask you this question, that as an Indian businessman, as someone who has been in this country for such a long time and doing business successfully, how easy or challenging is it to carry out business here in Kuwait?
See, Kuwait really very friendly country, very friendly country. And this is very cultural oriented company, country.
Okay.
And very family atmosphere, really very friendly atmosphere. Where is the problems, the expatriates, and they are without knowing anything, okay, and they don't know what is the left and what is the right, what is the rules and regulations, what is the how to establish the business. Without knowing anything, they will start a business. And within 3 months, it
They will
comes
stop,
down,
yeah.
it comes stop.
You need the know-how.
Shut down, and immediately maybe we'll see the, okay, that and shut down. Why shut down? My experience, they don't know what is the rules and regulations of Kuwait. First, before spending money, before making friendship with, to know what is the rules, how to reach, how to go, how to back.
That is important.
That is very important. And Kuwaitis people is really, I have hundreds of Kuwaiti brothers and Kuwaitis madams. Midnight, if I am calling to any of Kuwaitis, they are
They will respond.
They will respond and they will come and help. Not for business, nothing. Before also, they are really kind people. But some of small incident here and there. This is everywhere is there.
That is true.
Yeah,
That is true.
but my experience and Kuwaiti people is good. Kuwait rules and regulation, but anything not allow illegal things in Kuwait.
Yeah.
That is strictly not the same like other country. For illegal, they will catch you.
Yeah.
So
So you have to be careful that you don't do anything which goes against the laws of the country.
yes.
And you will be safe.
Yeah, 100% safe.
Yeah.
They will support. If you are some people saying Kuwait is not business friendly. No, they are. See, this is my example.
Yeah, exactly.
And not only me, many of centers in example AlMullah,
AlMullah also.
example Mugal Mahal.
That's right. That's right.
This
You're
is
right.
all are Indians
Yeah.
managing. So this is very.
So since you mentioned Indians managing, if I can ask you this question, that how do you see the contribution of Indian expatriates to the development of Kuwait? I mean, there sometimes people say, that Indians, expatriates are not required in Kuwait. How do you see the contribution of Indian expatriates into Kuwait?
See, this is very simple question, simple things like 60, 70, 80 years back. What is the Kuwait? That time also was money with Kuwaitis have money. Money is, economical strength is not everything. Without us, they can't. And without Kuwait, we can't. This is like clear mutual understanding. We are spending our physical, mentally and physically. See, we are leaving our family, our country, our atmosphere, everything, and coming to Kuwait to earn money. And we have to spend our everything. So we are spending, they are giving. So this is give and take. That's why I'm telling. Without us, they can't. Without them, we can't.
That is right. So it's a symbiotic. It's a relationship based on mutual need.
Yes.
We need them and they need us. I
Yes,
think that's
yes,
very
yes,
well
yes,
answered.
yes, yes.
So we've almost come towards the end of the show, but I would like to ask you, I mean, had heard about your philanthropy, I'd heard about your charity. And then when I spoke to your colleague, Mr. Hamza, he emphasized it. And I said, yes, I have heard of this many times, of your help to thousands and thousands of people who are deprived, who don't have money. So you have helped, as you said, and as I've heard otherwise, hundreds of bodies back to India. What inspires your philanthropy? What is it that inspires you? What is this giving, this constant giving on your part? And you do it very willingly. How does that happen? Where does that come from?
Actually, first of all, I was a poor person. My family was poor. So, me and my family, especially my mom, my mother always saying, see, without our besides of people are not happy, we cannot make and we cannot make happy and happiness.
So you need to make people around you happy.
So if I am a poor, I know how to suffer. Me and my family was totally even for food. We was hungry. I know my childhood and time. So after God given this opportunities and God given this much level of me, so I have to give back. I have to see back. I have to return back.
Yeah, okay.
Return back to whom? Same like before.
People,
Before
who are
me.
like, okay, who are like, yeah, what you were as a child.
Yes, yes,
Yeah,
yes.
yeah, yeah.
So I have to. This is I am doing.
Okay.
100%.
Okay.
Even is metro is here and my business is here, not here. Money is here and not here. I will be follow the poor and needy people to be there with me.
You will continue to
I
do
will
your
continue because I know what is the pain
of
of
hunger.
Hunger. I know what is the pain of health issues. I know everything. I know homeless people. This is I don't have. When I came to Gulf, I was me and my family was really same like on street, same like I don't have to any of and I shame to say.
Yeah, yeah.
See, this is my relative and home. Just the plastic and the
Plastic sheet.
sheet was just for cover it to
cover the
just
roof,
for to sleep.
okay.
So I know homeless people and I know hunger people. I know sickness. Everything I know because this is my own experience. What is the level of pain? I know. So I can easily to handle that things.
It's an extraordinary story of resilience, of courage, of faith, and of charity that we have heard today. And I am deeply moved by this story, and I am so glad that I have been able to document this and bring it to my audience of Sadaaqa out there. Now, but before we go, and we have to end on a happy note, we have to break in for Mughal Mahal's Ahlen Kuwait. So we'll just come back. Welcome to Ahlen Kuwait, brought to you by Mughal Mahal. And as I've always said, Mughal Mahal is one of the leading chain of Indian restaurants here in Kuwait. You cannot get away from Mughal Mahal if you live in Kuwait, whether you're a Kuwaiti, whether you're an Indian. And I'm sure our guest, Mr. Musthafa Hamza, is a huge Mughal Mahal customer. Am I right?
Yes.
So I am one myself, and all our guests who have come to on our show, Kuwaitis and non-Kuwaitis, Kuwaitis and Indians, have all been customers of Mughal Mahal, and I'm really very grateful to them. Mughal Mahal has been a partner, has partnered with Sadaaqa since the very beginning. I'm very grateful to Mr. Kalra, Mr. Suri, and the rest of the Mughal Mahal team. And so we have something very interesting and generous of them. This is a 50 KD gift card which they give to us to give to our guest. So there are different denominations. You can use them in any of the Mughal Mahal outlets, or you can give it to your staff, or you can use it yourself or to your friends. So, but you have to answer 5 simple questions.
Okay.
So my first question to you on Ahlen Kuwait is your happy place in Kuwait.
Happy place is like My see, I am different associations and office bear. I am one of them. So we are sitting to discussing for, as I said, like social activities.
Okay, social work,
So
yes.
this is my best place. I
I
am
mean,
enjoying like
you-
1 hour, 2 hour, whatever,
yeah.
in a different place,
I
and
understand.
this is the my best place.
Okay, so I mean, I think what has come out again and again in the interview is that the act of giving and the act of continuous giving is something that he is really passionate about. And so therefore his happy place is the place where he continues to give. So now my next question is the Kuwaiti food you most like.
Yes,
Kuwaiti food you most like. Which Kuwaiti food?
mandi.
Mandi.
Mandi, yeah, there is mandi, and same like majboos.
It's like
Yeah, fish majboos and the
Uh-huh,
chicken,
uh-huh.
and this is mandi is really
You like
they are
that?
yeah
Okay,
100%. Yeah.
okay.
My almost all Kuwaitis and giving as a gift this is the mandi
Oh,
and
that's
sending
nice.
to me. Yes, yes, yes.
Okay, the Kuwaiti you most admire and like, that Kuwaiti that you most like and admire. It's a difficult question to answer.
Really difficult questions. See, I have a lot of Kuwaitis and a different if categorization, if we make like to different officials, departments, head, and many of brothers and sisters and Kuwaiti friends we have. I cannot
Pinpoint.
make a single name.
Yeah.
These all are. And
Okay.
especially if I can add like Dr. Ahmed Al Azmi. He's my kafil, my sponsor, and my part of Metro. So he's the wonderful person. Entire home they came to my in India in Kerala, and almost all, not almost, the completely who and my friends of Kuwaitis, and still I am keeping touch.
You're
Not
still in
like
touch.
only for just for business.
Yeah,
No.
I understand.
Yeah,
Yes,
this is
yes. It
that's
comes
why I
from
can.
the heart.
Yeah.
Yeah.
That's why I cannot give you the single
One
name.
name.
Yeah.
Okay. Now, your favorite metro clinic?
This is, of course, our first baby always
Okay.
to be a responsibility,
Yeah.
and we are giving more responsibility to our first baby.
Okay.
So same like the Forvania is our
Metro
first Metro
Farvania.
Medical.
Okay.
So this is my
That is
favorite
your,
place.
okay.
Yeah.
And when you go from Kuwait, what will you take with you?
My experience.
Okay.
My experience, nothing. If I came by empty hands,
Yeah.
I'm very happy to go back to empty hands, no problem. But my experience is, this is my, if I say I'm a rich, it means my experience and as an expatriate, this is, they are given the 40 years, almost 41 years of experience. This is my everything.
I can very well answered, Mr. Musthafa Hamza. Thank you so much for being a part of Metro Medical Group Presents Sadaaqa. It was a real honor to have you on the show. So I am going to, before signing off, give this gift from Mugal Mahal to him.
Ashok Bhai,
Yeah.
Ashok, that pleased to, and Ashok Kalar is my friend. He is not only the business person, and he is a really very social and commitment person and a social worker. I know him and very well. He is really is my, not only my friend, almost all Kuwaitis friend.
That is right.
So and thanks Mugal Mahal,
Yes.
and without your gift, and you are a gift for us, and in as an Indians in Kuwait, we are very proud
We are
to,
very proud.
and the AlMullah
Yes.
and
AlMullah,
Mugal
AlMalam,
Mahal, yeah,
Mughal Mahal,
AlMalam, yeah, of
AlMalam
course,
as well,
of course, yeah,
our
yeah,
partners,
very
and
proud.
hopefully now
We-
Metro. So,
yeah, anytime. Thank you.
so thank you so much. Thank you. Thank
Thanks
you
a
very
lot.
much. Thank you
Thanks
for
a
your
lot.
time.